When I was a medical student, one of my favorite rotations was family medicine, family practice, as well as internal medicine. And the thing I liked most about it was the relationship that the doctor had with the patient. They many times saw them from the time they were little until the time they were into their teenage and into their adulthood. And that relationship was really great. But then I did a surgery rotation, and I just loved the technical aspect of knowing that when you were in there, you were fixing a problem, and when you walked out, it was really a sense of accomplishment. And so I decided I wanted to go into surgery at that point. But the thing I missed most in the surgery part of it was that relationship that you got with the patient. Well, once I got into residency, into surgical residency, I got to do weight loss surgery or bariatric surgery, and it was the perfect marriage of both of those of my favorite things. You got that great relationship with the patient, but then you still got to do the really cool technical part in the operating room. And the first time I got experience doing bariatric surgery, I knew that was the only thing that I was going to be able to do. And I often get asked, well, what if you weren't in bariatric surgery? What else would you do? Honestly, I tell you, I think I would probably get out of medicine. I can't see myself doing anything else. I just love it. I think that our tagline says it all: dedication, experience, and results. That's what we're all about. We've been in San Antonio since the 1980s doing weight loss surgery. We have more experience than any group in town. With the combination of all of us, we have about 5,000 cases that we've done. We're all from San Antonio. You don't have to worry about your surgeon doing your operation and then going back to Houston or Oklahoma or any other place around the city or the country. I think our experience speaks for itself. We're really proud of the results that we get. How proud are we? We actually publish them on the website, and you can click a few pages over and see those results for yourself. We are our centers of excellence, and that's a really difficult designation to get. An independent organization comes in and it basically tears your program down from top to bottom, and you have to meet some really rigorous criteria to qualify it as a centers of excellence, and we've done it, something that we're extremely proud of. We have a dedicated bariatric staff. All they do is work to get you through the process, taking you step by step through what can, for some people, can be quite a long journey. And they're there to help you step by step. From the beginning to the end, we're here to help you on this weight loss journey. After weight loss surgery, some patients can experience vitamin and mineral deficiencies. With the gastric bypass, we bypass the first part of the intestine called the duodenum. That's where most of the absorption of vitamins and supplements occur, particularly things like vitamin B12, calcium, and iron. So gastric bypass patients need to be on supplements for the rest of their life. If patients aren't taking supplements or taking adequate amounts of supplements, they really can develop some severe vitamin and mineral deficiencies. The good news is if a patient's following our recommendations and following up, vitamin and mineral deficiencies are actually very uncommon. With lap band patients, they also need to be supplemented in their vitamins and minerals, but for a different reason. With lap band patients, and in fact with most of us, I would say, we get our vitamins and minerals from the foods that we eat. Well, after lap band, patients are eating less food and therefore taking in less vitamins and minerals. And so in both groups of patients, our band patients and our bypass patients, we think supplementation of vitamins and minerals is very important. Again, it's extremely unusual for patients to get into severe vitamin and mineral deficiencies if they're following up, because during your follow-up visits, we're going to be checking your blood work to make sure that you stay out of trouble. I think attendance of support groups is really key after weight loss surgery. Imagine being surrounded in a room with 50, 60, 70 other people who are going through exactly what you're going through and are sharing the same emotional changes that you're sharing, the same physical changes that you're sharing as well. It's really a powerful tool, to help you along this weight loss journey. We offer a number of support groups in our practice, those for lap band patients, we have those for gastric bypass patients, we have those for only men. Sometimes men only want to be with other men, and we offer a support group for that. We also offer a support group for patients who are more than a year out from their surgery, because once you've gotten to that point, the issues that you're facing oftentimes are different than the patient who's just a month or 2 months after their weight loss operation. In our practice, we understand that the surgery is just one part of your overall success. It's certainly important that we give you a good, sound, technical operation, but once you've gotten that, now we need to begin the rest of the journey. And that's really one of the key features of our practice. We each understand how important follow-up is, and not only short-term, but really long-term. And the fact that we've been around for so long can tell you we're not leaving San Antonio. We're going to be here for you long-term. Well, why is follow-up important? The things that need to be learned after weight loss surgery in order to keep you successful need to be taught, and they need to be reinforced over time. And that's what we do during follow-up. As you'll see, very little time is actually spent talking about, are you hurting? Are you this? Are you that? It's really spent in teaching you how to use your operation to create long-term success. That's what follow-up is all about. There are also problems that can come up at different stages after your weight loss operation. Almost any problem that can develop after weight loss surgery has signs and symptoms that go along with that. That's our job, is to pick up on those signs and symptoms to keep you out of trouble. That's what we do during follow-up. Weight loss surgery is not like having your gallbladder out or maybe your appendix out. It requires long-term follow-up. We'll be here for you, and we want to see you over the long haul. Insurance companies. Many days the bane of my existence. The good news though in the state of Texas is that about 60% of companies cover weight loss surgery, and that's much better than we see in many places around the country. And even better news is that a lot of companies are moving towards covering weight loss surgery because they see the value in resolution of diabetes and high blood pressure and all of those other sorts of medical problems that get better after weight loss surgery. I expect over the next 5 years we're going to see even more and more companies begin to cover weight loss surgery, which I think is fantastic. What about your individual case? Well, I would encourage you to look at your policy, and it should be outlined in there. Does it cover weight loss surgery? If your insurance policy covers weight loss surgery, we definitely are going to get you approved. We have dedicated staff who their only job is to help you through the process and get you approved for surgery. What if your policy doesn't cover weight loss surgery? Well, we can help you as well. We have several different options to help patients whose insurance plan does not cover weight loss surgery. The other thing I would tell you is I would encourage you to go talk to your human resource manager and find out if in the future your plan, your job, your work is going to be covering weight loss surgery. We're also happy to help in that. I talk to human resource managers and companies all the time about how weight loss surgery can actually improve the bottom line for your company. I think one of the biggest concerns of patients who undergo weight loss surgery is this going to work for me, or am I going to fail again? And I think that comes from a lifetime of dieting and then regaining weight. This is where surgery makes a really big difference. We can see patients not only lose a lot of weight, but then keep it off long term. Well, what separates patients who are successful long term versus those who lose weight and then regain some weight over time? I think the real key is follow-up, because in the follow-up visits is where we're teaching you the tools, giving you the tools to get you to be successful, not only short-term, but more importantly, long-term. As it turns out, the surgery is actually the easy part. It's really learning how to live after your surgery That is the challenge. And that involves multiple different areas. It involves dealing with all of the habits that got you to the point that you considered weight loss surgery in the first part. So we have to look at behavioral reasons why do we eat. Are we eating because we're happy? Are we eating because we're sad? Are we eating because we're bored? Instead of eating because we're hungry. We have to look at getting you more active. And the beautiful thing with weight loss surgery is we take the weight off, it becomes a lot easier to go out and be more active. We also have to look at the things that you're eating. I tell my patients all the time, we put junk in, we get junk out. Weight loss surgery is about changing lifestyle, and it's about using that new tool to help you do some very challenging things. Change lifestyle. The good news is that if you work with your operation will serve you for a lifetime and you can keep this weight off forever.